happening at Lumosacre Junction?
LSTV.
Uni or bi?
Bye.
Bi, okay. That white band that you see is pseudoarthrosis, subchondral sclerosis. That is, it's a pseudo joint, but it's also undergoing degenerative change. So you go then into article mode, okay, complications thereof. Why am I here? Okay, we did this, and we said, what was the importance of this? The hand x-ray.
The scaphoid.
Scaphoid, okay, fair enough for wrist, okay, but when it's this, that's not normal anatomic alignment compared to this.
Correct.
You don't have to look, you can go to orthobullets and get, it's fractured orthobullets to find out what kind of fracture that comes in semester 8. But the point is, you took a wrist x-ray or a hand x-ray, if we see dips or ends of dips, okay? But then we talked about compromise to the distal or proximal joint. So if you don't align this properly or get it aligned properly, and you wouldn't know that until you saw it, then someone has to make a decision how it gets treated. And then on the follow-up x-ray, if this continues not to heal well, it will ultimately affect the distal and proximal joint. And Angela did a nice job of memorializing that. And I just had my input into the memorial part of it, and teaching points have a habit of showing up on exams. Okay, what's going on?
Occipital.
How do you know?
There's a,
There's no space between the occiput and
No space, okay? So if I didn't tell you, I will now. I see them 4 times a year roughly, okay? From what I do, all right? And it's all about Arnold Chiari. This will come, we can incorporate it today, because if we have a sudden contractile muscle activity, okay, I can avulse here, which is hip. I can also have avulsion of the greater trochanter, or whatever the tendon is that attaches here can repetitively pull, and then this greater trochanter becomes malformed. That's part of your hip evaluation. Not malformed, has degenerative changes at the tendon periosteal junction. Okay? The thing to point out today is when you do a nice hip examination, you're able to see the lesser trochanter. All right, so the yellow was what? What are the yellow, why is the emphasis on the
the
yellow?
attachment points.
Not more, attachment point, but what was the significance of the attachment points?
degenerative changes,
Not degenerative changes.
sclerotic.
Avulsion, so if you have a sudden dramatic contraction, okay, that part can avulse. There are common areas for avulsion. Or repetitive stress can give you funky looking areas at that site as well. All right, just knowing that, okay, it gives you hands up, legs up on, okay, decision making. So as we get older, our ischial tuberosities get really weird looking compared to an age-matched sexed individual that's a couch potato. So if you're really, really active, you can get ischial tuberosity irregularity. That's just age-related change, but because you're a active weekend warrior, yours looks different than someone who just does nothing but watch TV.
Do all of these avulsion sites become more unstable as we get older?
Yes, because this is the muscle, this area becomes less dense. So as we lose bone density from osteoporosis or whatever, okay?
Becomes weaker.
Yes, becomes weaker. And then not a sudden contraction, but a less than 100% contraction will cause injury, okay? Because it's not normal bone anymore. So the point is, knowing this, okay, you don't have to memorize it, you put it in your digital vault is the point. And I'm talking to the essence about the history of chiropractic education. Why? I don't know why. But I am trying to impress upon them, theoretical information is theoretical information. You want to be able to apply it. I'm all about application, I think, all right? So they don't understand the importance of avulsion. Are they going to remember between then and now?
No.
Probably not, okay? They're not where you are. But the point is, it's common stuff. And you don't have 2 hours in clinical practice to spend time Googling it, okay? So your digital vault, I'm putting in the radiology part of it, but you could apply the same principle in all the other courses, okay?
Mhm.
So if you've never seen surgery before, the teaching point is this is metal, okay? These are usually disc struts, meaning they try to hold the disc in place, old style, okay, but the observation is more than that. What's the observation? Given that you've had this,
No,
But it's a mobile?
that's a normal, no,
No spinous process.
no spinous process, okay? Now, I don't have, on this one, I don't have the lateral, but the teaching point is it's metal. There's been laminectomy intervention, spinous process removal, okay, and what does that mean to you clinically is the big question. All right. We talked about this, I wanted to get to good positioning, but even if it's badly positioned, arms up. And when they took my pre-surgical screening x-ray at the hospital, I just had to hold something up here, and everything else was laser determined. Just x-ray, put your hands up here, the machine just goes bzzz, 1 inch or a couple inches above the shoulder. It was automated, I mean, it was fabulous. I wish I could have taken you all there to see me being x-rayed. Did I get banana shielding? No. Okay.
You can redo it in a clinic, right?
Okay, but even though it's badly positioned, the arms are not up, okay, we still can see things, right? So what are we seeing?
L1.
Spina bifida.
Yeah, spina bifida, what level? 5, 4, 3, 2, and 1. Okay,
Yep.
all right.
Osteodentoidum, osteodentoidum.
Okay, osteodentoidium, and you know what that means.
Yep.
Okay, it's a lot more common, certainly in South Florida. Anywhere, any metropolitan area where there's lots of car accidents, you're gonna get this. Okay? Pelvis, we don't need a gonadal shielding, but so the question is what use is the gonadal shielding when it's not in the area it's supposed to be protected? That's all this is showing you. Okay? I do have hip x-rays in here. All right, that was the point of it. All right, so there's normal variance coming. Okay, this is a little ossicle, it's in the PowerPoint presentation, I just wanted you to see it. Okay, but the idea is if you get plain film and MRI, they're asking you to make a decision about the MRI. Is it the same size, is it worse, is it better? Okay, and I think the better strategy is to go through your search pattern and see what you see here, because if this is os acetabuli, this being the acetabulum, and that's not one of the choices on Part 3 National Board, no. Go through your search pattern, and maybe they're wanting you to talk about the MRI in some way, shape, or form. They're not going to go into some kind of detail about the muscle attachments, they're saying this in relationship to this. Does that make sense? Okay, one of the reasons why we do it. We'll teach you about knee anatomy, knee positioning. Okay, the big takeaway here is child or adult?
Child.
10-year-old, so this matches this because this is the growth plate, and this is as subtle as sometimes the injury is. This is tibial tuberosity. If this is a soccer player, it means one thing. If it's not a soccer player, this is the normal secondary center. Okay, now how would you know that? Well, you would find an age and sex match normal knee, okay, in either bonepit.com or Google it, okay, but again, you don't want to waste a whole lot of time finding a reference point. All right, now, Jeremy may want to do a lot of sports injuries. If you don't want to do sports injury, you don't have to worry about this. But yes, you do before you, my exams, national board exams and clinic, if you have a 10-year-old come in, you're gonna say what? Give them to somebody else?
No.
Okay. All right, we're gonna show you ankle, all right? So this is not normal. I've got enough information to make a good clinical decision, but the teaching point is what happens when things expand beyond the confines of a bone, an osteostructure, the cortex.
And break.
It's not good.
Not good, can fracture, okay? Especially if someone kicks this person, okay? On the lateral distal side of the fibulus, in anatomic position, left side. Now, what does the MRI add to it? The MRI, this is what we see the outpouching or the expansion, but I can't see this nearly as clearly on my plain film as I could on the MRI. So it's actually bigger. That's the point to it, okay?
Is
Now,
that osteomyelitis or?
No, don't go there just yet, okay? It's not normal, it's not a normal variant. But what does this add? It adds size. This corresponds basically to this. This is an extra component that belongs to this. Now, why does the orthopedic surgeon want this? Because he's gonna have to do a lot more work with this compared to had it just been there, okay? Patient presents to a chiropractic physician complaining of ankle pain, okay? All right, so just examples of things that presented to chiropractors that I happen to collect, okay? So I think it's important that you see them, all right, so, because I've collected them, it's not Kaiser's intellectual property, it's my intellectual property. Okay, now you can load up the hip. And I'll do the same.